I'm Beth Machnee. I'm a family physician out in Yorkton. So just a few reflections on our time this year. My project was establishing gold standards in congestive heart failure to admitted patients in the Yorkton Hospital. And how I did that was I focused on implementing a discharge checklist to aid with these gold standards. So objectives for my presentation are just a bit of reflections on our learning experience and then my plans for ongoing development. So reflections on learning. When I first got accepted to CQIP, this is how I felt. I was so excited. And then after my first workshop and coaching meeting, I kind of felt slightly overwhelmed, as Puna had already alluded to. But then overall, I think my experience has been an upward trajectory with a few bumps along the way, but still a good experience. So the objectives of the program were to serve as internal consultants in clinical quality improvement, to teach clinical improvement, and to lead and facilitate clinical quality improvement projects. And I think I've achieved all three of those objectives working through this program. I really enjoyed how the learning was a kind of a stepwise approach with our coaching meetings, our online modules, and then the workshops, and that really helped me move my project along as well as augment my learning with that. I did have some challenging moments along the way. Data collection was a challenging moment, which I think a lot of people have alluded to. The data I wanted initially was not there, as well as kind of interpreting different control charts, those kind of things. I think I've got it figured out now, but there's always learning. Establishing project size was also challenging. My project was way too big when I started, and then I had to scale it down again, and then again, until I felt my project was a little bit useless. But as somebody has already said, no project is useless. We learn from everything. And then again, spreading change is a little bit difficult because I thought everybody was really excited to change and really excited about my project, but that is not always the case. So finding those early adopters for change to help spread your project I found challenging, but when you got there, it was great. So reflections on my experience here. So some aha moments. The first point, some practices in medicine are better standardized and not left to physician preference. Sounds like an obvious thing, but it really this program really cemented that into my head. So we're decreasing physician stress load to help physicians make better decisions and better medical care. What I think a root cause of an issue is probably not the root cause. There's probably many different causes, and so doing your diagrams and root cause analysis is very important, and getting that whole team around, because what you think the cause is probably not the issue. So that was an aha moment for me. And then variation within clinical practice can be more harmful than good. And that, again, this program really cemented that into me. And my why statement, I know somebody else had mentioned their why statement, how that was kind of a breaking point or a aha moment. We had a great speaker come and talk to us about kind of why we do everything in life and how that we can bring that to our project. And so not only do I realize kind of why I do things in life, but also bringing that back to my team and saying, so this is why we are doing our project. Let's make our why statement for that, so then we can all be on board and all be really passionate about it. My new way of thinking, I've talked too long, so I'm going to quickly go over that. Successful moments, implementation of my checklist, excitement from everybody around on my team, the friendships we've made through Cohort 2, and again, understanding my why statement. So plans for ongoing professional development. I'm actually starting a new job as a hospitalist in Regina in December. I hope to continue using my QI skills there. Right now, we've just recently started in our clinic in Yorkton an advanced care directive quality improvement project. So we're seeing how that goes, and then I'm going to be coaching in Cohort 3. Thank you.